Welcome back to the EAU Podcast series, Effective Performance and Personal Success. In this episode, we are joined by Juan Luis Vasquez, a consultant urologist at Zealand University Hospital. Juan is also Associate Professor at University of Copenhagen, Denmark, and the chair of the EAU Young Urologist Office. Also Jason Howlett, a coach specializing in behavior change, mental resilience, and well-being. He helps individuals and organizations optimize their performance by aligning energy, focus, and habits for sustainable success. Together, they discuss the essentials of attention management, explore strategies for improving focus, minimizing distractions, and optimizing cognitive performance. Join us to learn how to take control of your attention and enhance productivity.
Hello again. Welcome to the new series of podcasts from the EAU, where we're talking about effective performance and personal success. This time, we are going to talk about attention management, and with us we have again Jason Howlett. Hello, Jason. Welcome and welcome back. It's nice having you back.
Thanks, Juan. It's great to be here, and we also have the pleasure of being with your dog as well, which is, as some of the guests may hear. It's good.
Yeah, so
it's a nice cozy atmosphere.
He can be a little bit noisy sometimes.
So, it's great to be here, and we have an exciting topic today with attention management, and definitely a topic that is extremely challenging for many of us in this kind of attention economy we live in.
Yeah, so can you start by introducing what is attention management? When does it apply? Because we have different situations where we need to be aware of what we're doing and not being disturbed. For instance, when we're doing surgeries, also when we're talking to patients, but also maybe when we're reading or doing some scientific work.
Yeah, that's a good question, Juan. So what we mean by attention management is this ability to literally manage our attention. And the thing is, that can be quite hard. So even when we're not getting distracted by things outside of, our brains, but also internally, right? We have all sorts of internal distractions. So even when we are, let's say, in a state of mind and in an environment where there's no distractions or interruptions happening, it can be still quite hard to concentrate on one thing at a time, right? So to focus our attention. It can also be quite hard to enter a room and then be present with others, right? To actively listen to others and engage in conversation. And then something else that can be hard is to kind of do the opposite, which is to let our brains just zoom out, right? So instead of focusing in, we're focusing out and letting our mind wander, which can be really beneficial actually for creativity, right? So we've got these different kind of ways of managing our attention. We can focus it in and try and concentrate to read or write something. We can, be in a conversation with someone where our attention, we, both have to be clear on what we want to say, but we also need to ensure that we're not just in our, focusing on what we want to say all the time. We also need to be able to listen to others and actively listen to them so we can best respond. And then, as I mentioned, we have this other thing of letting our brains, wander and focus out, which can really benefit us for creativity. So that's what we mean by managing it. And what we can cover is some tips for how can I best get into a state of mind that is more conducive to, for example, concentration or being present or being creative.
Yeah, I personally, probably this is very different from person to person. I don't think it's difficult to concentrate or attend to what's going on when you're doing a surgery because you have nothing else to do. I mean, yes. Your phone is not with you, so you don't have all these pop-up messages going on. But maybe, and also if you have when you're talking to a patient, maybe that's also a little bit easier. You don't want to have like this phone ringing all the time on stuff that's going on around. But for instance, if you're doing scientific work and you need to focus and concentrate on what you're writing or what you're reading, how do we do to, I mean, the easiest way will just throw out your phone, but that's not something we regularly do, right? So how do we do to stay focused?
Yeah, great questions. And there's things that we can do that are ourselves for our own sort of mental concentration. And actually a great thing to do before you're going to, be in a situation where you want to concentrate is to take a walk. As little as sort of 10 minutes can help. It could also be to do a breathing exercise, because again, it helps to relax us to create a clearer mind. Of course, we could practice meditation. Meditation is literally a practice of being better to focus attention. So the things we can do to prepare us to go into that situation with a less sort of busy, distracted mind. But then there is also the environment around us, as you mentioned, with the phone, right? So, if we are not in a kind of do not disturb mode, which luckily these days are quite easy to set up both on iOS and Android, you can, really customize a do not disturb mode where all notifications are silenced, other than ones from like SMSs or phone calls from your favorites, which might be a colleague, might be your family member. So you can actually schedule these do not disturb modes, or you can of course switch them on with your phone. And actually I've seen, especially for some of the younger generations, it could be a very good idea to have your phone on do not disturb out of arm's reach, right? Or in another room where you'll hear it if there's a phone call, so you're not going to miss any emergencies. But it's harder to check your email, your chat, or your social media, or whatever it is you might want to check, because it's out of arm's reach. So that helps with that aspect. And you can do the same on your computer. So if you need to use your computer to get your work done, Microsoft have something called the Focus Assist and something called the Notifications and Action settings. And that can help you to silence all other notifications. So you're not getting pulled, your attention's not getting pulled onto something else. And a lady called Gloria Mark has found in her research that it takes on average 25 minutes for you to be able to refocus. So if you're doing something, let's say you're writing a document or reading a document for your research, and you get this notification that you've got an email or a chat message, then on average it's taking you 25 minutes to come back to that first document with that same level of focus you had before. That's average.
That's a lot.
That's a lot, right? So that's it's called task switching waste. And it's a huge waste. And of course, then we got multitasking. Some people try and do two things, right, at the same time, but that just isn't possible for our brains. Our brains are sequential. So on average, it's showing that it takes us around 40% longer to do things, in a multitasking format versus doing them sequentially. So it really pays to, set up the right environment as well, so we're not kind of pulled onto something else. And in terms of getting interrupted by other people, we can kind of think, where do we need to be to increase our chances of success, right? Or what communications or agreements could we have with our colleagues where if I put on my headphones or earphones or put a light on my screen, or I show a visual cue, then that means I really need to focus. Please respect that. And of course, I will respect your focus time when it's needed. So there are ways we can kind of set up the environment, but there are also ways we can prepare our brains to be better able to concentrate.
How do we know when we're being distracted? Is it that easy to figure out? Or how do we know if we are really focused?
Yeah, I guess the simple metric there is just our ability to achieve what we want to achieve, right? So if we're reading a document, we can, read that document without finding ourselves, constantly thinking about something else or, constantly checking our phone. So it's this ability to succeed with the task we've set ourselves. Yeah. That's kind of one thing. And again, it's important to be, kind to yourself, because our brains can't continually concentrate. So if we can get into this state of concentration, that might only last 20 minutes or half an hour, or maybe even less, 10 minutes. So it's also trying to be realistic and kind of break whatever we want to do up into smaller segments, but then just monotask, like focus on that one thing for, a fixed period of time, and then say, then afterwards I'll take, 5 minutes to recover, which could be the breathing exercise, or it could be doing something else, a different task, or even, again, checking social media, but you just then, having a time when you're doing that, a dedicated time afterwards, you're not constantly doing that throughout the task you're trying to get done.
Okay, so now we know that, of course, the telephone is, the cell phone is the guilty of of all charges, right?
Yeah.
But there are other things that also can tend to distract us, and that can be our own thoughts. When you're being overwhelmed with many things, like my partner told me to buy milk, I have to remember that.
Yes.
Or my boss is being an asshole, or I don't know, whatever. There are many things that can also be taking your attention into all the things rather than to what you're doing. But that's not your fault. Your cell phone's fault, right? It's your thoughts. How can we control that?
Yeah, so that's a very good point, and we all suffer from that. So one of the ways you can do, let's say you want to sit down for an hour and read or write something, right? Or create a document, prepare for a meeting, whatever it is. It's great to just write down whatever's on your mind. Just write it down onto a piece of paper or into a digital document, but just to, write down what we're concerned about, what we're thinking about, and if possible, also write down what an action could be to address that. So just being able to write something down is a way of processing what's on our mind. Maybe even, as I said, come with some actions of how we could address it. So then we are, if you like, less stressed about it. But then after that, again, doing, like we talked about in energy management, doing some kind of slow, deep breathing or taking a walk, but doing a kind of recharge practice that can help lower stress and kind of clear the mind is another way of kind of preparing us to have less potential distractions. And I think last of all, maybe revisiting the purpose of what we're about to do, right? If you've got a clear intent on what you want to do and you know how important it is, whether that's, again, to focus in on creating or reading a document or going into a meeting and being present, reminding ourselves of what is the purpose here, can build more intrinsic motivation to really work with our attention. But of course, if we go into a situation we don't really care about it, then of course it's a lot easier just to say, okay, whatever, and now I'll check the next, update on social media or the news or whatever it might be. So that kind of intent on what we want to achieve, the purpose, it can help us.
So are there any other ways? I mean, does music help, are there other media that can help you stay in the focused mind? Yeah,
definitely. When it comes to listening to something, there are these things called binaural beats, which sounds pseudoscientific, but there's actually a lot of evidence behind listening to binaural beats, which is essentially where you've got one tone played in one ear and another tone played in another ear, and your brain actually tries to sort of almost build a third tone out of what it's hearing. And there's a lot of science to show how that can help us to focus, listening to binaural beats. And you can find those on YouTube, Spotify, Apple Music. They're everywhere. So that is, that's something, listening to binaural beats. There's also just white noise, right? So listening to white noise. Or when it comes to music, often, non-lyrical pieces of music that you really enjoy, and that could be everything from classical to rock to some trance or dance music. The key thing is you enjoy it, but you also don't find that your brain is then kind of going towards that music, especially again, like with lyrics, it can be very distracting. So that can help you, in addition to also like, how are you listening to music? If you have headphones or earphones on, they could also be noise cancelling. So they can drown out other sounds that might distract you. So that can help from an audio perspective. And then you got the visual perspective. So if you're in an open plan office or, in the hospital where there's other people around, try and either, go to a separate room, or if you can't do that, maybe you face a wall or the window rather than face out into the room. So you're kind of limiting your visual kind of distractions. And then last of all, think about where you're sitting, right? Trying to have a clear space, so you haven't got like a whole, hundreds of pieces of paper and different things around you. You've got this kind of clear space so that, again, you're not going to be visually distracted.
Yeah, okay. So we've been talking a lot about how to focus when we're doing our scientific work. But I know we have people listening who are residents or young urologists. So there are also situations like surgery where you actually need to be very focused. You are learning this procedure, or you are going to do a complicated procedure, and you really want to perform at your best. Is there a way to prepare so you can be fully focused on this?
Yeah, indeed, Juan. I think that's a super question. So, I mean, ideally, you have, whenever you're going to have a surgery, you have a certain period of time also where you can prepare, right? And, whether that's blocked out in your schedule and therefore calendar or not, it's good just to go through a few mental preparations. So first of course, you're reminding yourself, like, what is it you're going to do and why you're doing it? So what's the purpose? And that's kind of pretty clear, right? It's almost shouting you in the face. But then once you're clear on, what you're going to do and the importance, then that's where the magic comes from, doing something as simple as just spending, a minute or two on a breathing exercise. So, breathing is the fastest and simplest way we can, lower our level of stress or activation and therefore kind of create a clearer, faster way of thinking. Right? Because the more stressed we are, yes, we might have a fast way of thinking, but it can be a very kind of scattered, reactive way of thinking. So, very simply put, linking to what we did in the energy management podcast, doing slow, deep breathing, whether that's the psychological sigh again, where you're kind of taking a deep inhalation through your nose, then a second kind of sip of air, so a second inhalation, and then a long exhalation. You could repeat that a few times. Or you could just simply take some long, deep, slow breaths, right? The point here is to really, take what is a clear intention and then quieten your body and therefore your mind through this sort of relaxation technique. Others, if they have the ability, might want to lie down, close their eyes for a little bit. It's just really ensuring you're not on your phone just before the surgery, right? So you're not filling your brain with unnecessary things from social media, the news, or other emails or work. You're really giving yourself this space of, 2 to 5 minutes to clear your mind. You might even, if you've got a lot of things on your mind, write them down. So really kind of capture any thoughts, feelings, write those down on a piece of paper or into your phone, and then do the breathing. That is something I've seen can work, or has worked for a lot of people to give them that clarity of mind you talked about.
Now I'm thinking about, when you were talking, I was thinking about the different situations, and I thought, well, would there be a way to prepare for complications during surgery? Or is it something that we can do while we are doing the surgery, like getting prepared?
Yes.
In this movement, something can happen.
Yes.
And need to be top at this moment.
That's a very good question, and I think it's when you're planning, it's very good to look ahead and think, where are there moments in the surgery where we have the highest risk that things could go wrong, and really be clear on that. Think it through in your mind, but they're the sort of moments where you also really want to be focused on your breath. Because the thing is, as we start to, experience the pressure, or, we feel the stress rising, our breathing will become shorter and shallower. And again, if we've done the thing we're doing many, many times before, we have more of an automatic kind of responsive reaction to something going wrong. But if we're doing this for the first time, we need to really be in a resourceful state to really think and consider what should we do next, right? And if our mind is just full, or we're almost in the panic zone, we're not going to be able to think clearly. So actually, if you like, being conscious of your breathing and remembering to do those slower, deeper breaths can really help you through these higher pressure moments. Does that make sense?
It does make sense perfectly. So we need to round up, and to summarize, we've been talking about how to stay focused on the activities that matter and that are important at the moment we are. And a key thing is breathing exercises. We have talked about it for all the podcasts we have mentioned those. And we are going to talk even more and more into depth and go into the different techniques when during the Tallinn incubator in Valencia. But breathing exercises are kind of like a key to stay focused, right?
Yeah, I think that, they don't need any other tools or apps or anything to learn. It's just good to, of course, practice them yourself and to find out what works for you, right? And you can, as we'll learn in the incubator, you can both do techniques to relax and become more alert, as we're talking about here, but there are also techniques you can do to activate yourself. So you bring even more sort of energy and even more alertness to the situation. So regulating your breath is a great way to regulate how you feel and how you think.
I think actually the Marines do these breathing exercises, or these
they do box breathing
in Danish. These
exactly.
top military folk.
The special forces, they often do the box breathing, which is where you breathe in for 4, hold your breath for 4, breathe out for a count of 4, and then again pause for 4. Yeah, that's a very common technique.
All right. Well, thank you, Jason, once again for being here. It was a pleasure. And I would like to remind you to apply for the Talent Incubator if you want to know more about this. Module 2 in Valencia in April from the 10th to the 12th. Really great time. We actually don't only get a lot of theory, but we also do apply it, and we go running together, and we go rowing together, and practice all these breathing exercises, different techniques of breathing exercises.
It's a great experience indeed.
Yeah. Thank you, Jason.
Thanks, Juan. Thanks for listening.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.